a workplace hazard. A workplace hazard is anything in the workplace environment that can cause harm to the employees. That includes an ergonomic hazard, chemical hazard, physical hazard, biological hazard, and psychosocial hazard. Now, I will show you some scenes regarding the mentioned hazard and a more detailed explanation in the next minutes. So let's get through it. Do you notice how uncomfortable the employee was? He has some muscles, neck pain, back pain, and even shoulder pain, right? That is ergonomic hazard. What is ergonomic hazard? Ergonomic hazard are physical factors in the work environment that can cause musculoskeletal disorder (MSDS) and other health problems, usually arise from the interaction between the worker and their job, tools, and environment. There are several types of ergonomic hazards, which consist of awkward posture, repetitive motions, forceful exertion, contact stress, vibration, excessive noise, and extreme temperature. There are many sources of ergonomic hazard. That is, poor workstation design, such as unsuitable chair height contribute to awkward posture and repetitive strain. Other factor is improper lifting techniques, such as handling heavy loads with the lack of mechanical assistance can cause in MSDS. Other than that, repetitive movement without sufficient rest increase the risk of RSIS or repetitive strain injury. Poorly designed tools and equipment that are difficult to use or uncomfortable to hold can contribute to MSDS. Moreover, environmental factors such as extreme temperatures, excessive noise, poor lighting, and inadequate ventilation can negatively affect workers' well-being and contribute to ergonomic hazard. Health risk from ergonomic hazard. Musculoskeletal disorder (MSDS) is the common consequences, encompassing conditions such as back pain, neck pain, carpal tunnel syndrome, tendonitis, and bursitis. Reduced productivity. Pain and discomfort can significantly impact work efficiency and output. Increased absenteeism. MSDS often lead to increased sick leaves and loss of work days. Psychological impact. Chronic pain and disability can cause stress, anxiety, and depression to the workers. How to prevent ergonomic hazard from happening? Prevention of ergonomic hazard is through an ergonomic assessment, means to regularly evaluate workstation and work processes to identify potential hazard. Workstation design, making sure the chair height, monitor placement, and desk setup is comfortable to promote good posture and reduce strain. Training and education for employees on proper lifting techniques, posture, and work practice to minimize ergonomic risk. Administrative controls, implement changes in work schedules, job rotation, and rest breaks to reduce repetitive strain and fatigue. Personal protective equipment (PPE) is used to provide appropriate PPE, such as hearing protection, gloves, and anti-vibration tools where necessary. In conclusion, ergonomic hazard reveals itself as a huge threat to the workers' well-being. However, with proactive measures such as ergonomic assessment and employee training could prevent the hazard from affecting the workers, as it provides the employees with a comfortable work environment.
Hi, let's talk about chemical hazard. What are chemical hazards? Chemical hazards are substances that can cause harm to human, animal, and environment due to their chemical property. There are four main routes of exposure to chemical. First, we have through inhalation when you breathe through chemical vapor, fume, or gas. Second, we have through indigestion when you consume contaminated food or drink, or through hand-to-mouth contact. Third, we have absorption. Some chemical can enter your body through skin contact. And lastly, number 4, we have injection. This happens when you use needle or sharp object that has been contaminated. So remember to always use the sterilized one first. Do you know most people aren't aware of chemical hazard in their daily life? These chemicals can be found in your household product such as cleaning agent, pesticide, and personal care product. In the previous scenario, we can see the person spraying mosquito repellent excessively. After she done spraying, she tried to drink water that has been contaminated with the repellent. This situation illustrates chemical exposure through inhalation, indigestion, and absorption. Do you know mosquito repellent contain N-diethyl methyl toluene? This is also commonly known as DEET. This chemical is widely used but can be dangerous if overly exposed. Exposure to chemical hazard can lead to various health issues such as eye irritation when you feel burning sensation, pain, or your eyes become red. Then you have respiratory issue when you have difficult breathing, coughing, or throat irritation. You can also have neurological symptoms where you feel dizzy, headache, or on some case you can have seizure. You can also have gastrointestinal problem where you feel nauseous, stomach pain, or vomiting. What to do if you are overexposed to chemical? First, for eye exposure, you should quickly flush your eye with water for about 15 minutes. For absorption, you should wash the affected area with water and soap. If you inhale the chemical, you should quickly move to an area with fresh air. But if you have difficult breathing, you should immediately seek for medical help. For indigestion, do not force yourself to vomit unless you are instructed by a medical professional. You should drink a small amount of water to help dilute the substance. If the symptom got worse, you should go to the hospital immediately. Is there any way for you to prevent chemical exposure? Yes, there are 4 ways to prevent. First, when handling chemical, you should always use personal protective equipment, also known as PPE, such as goggle, mask, and glove. Second, before using any chemical, you should read the label on the bottle so you understand what you should do and shouldn't. Number 3, you should have basic knowledge on emergency procedure for handling chemical. And lastly, remember to keep chemical away from children's reach because it can be so dangerous. So remember guys, stay safe and be aware of chemical in your daily life.
Biological hazard. A biological hazard can be defined as a biological substance posing a threat to health of living organisms, mostly human. These include microorganisms, virus, toxin, and bioactive substance capable of instantaneous infection, allergies, or other health effects. Type of biological hazard. First, bacteria. Some bacteria can infect the human body in case of possible contact. Salmonella is responsible for food poisoning, while Mycobacterium tuberculosis lead to tuberculosis. Virology. Virology applies to infection disease or health condition in animal caused by influenza, virus, HIV, and others. Fungi. Some fungi can cause respiratory problem or infection. For example, aspergillus, which can cause allergic reaction or toxicity. Parasitology. This category involves organisms such as Plasmodium, the causal agent of malaria and giardia, common parasitic agent affecting human, getting organism via food, water, causing of the health problem. Toxin. Organisms like Clostridium, Botulinum, or Bacillus anthracis produce toxin can incapacitate people even in tiny amount. Let's see some example. Sources of biological hazard. The healthcare and laboratory setting. Exposure to infectious agent via a patient or laboratory sample. Agriculture and animal handling, contact with animals or animal waste, and zoonotic disease. Food and water contamination. Bacteria in contaminated water or food can potentially cause a widespread outbreak. Waste management. Dealing with human waste, sewage, or other hospital waste can expose workers to hazardous pathogen. Health risk from biological hazard. Health risks associated with biological hazard with exposure include infection diseases such as tuberculosis, hepatitis, and influenza. Allergic reaction like mold spores. Toxic effect. For example, is botulism due to bacterial toxin. Prevention and control measure. Awareness of biological hazard or potential holocaust destruction caused for short and sound control measure. Personal protective equipment (PPE) need to provide such as glove, mask, gown, and eye protection. Hygiene practice such as proper hand washing, sanitization, and waste disposal. Environment control like ventilation, centralization, and disinfection of surface. Vaccination and health monitoring. For example, immunization against many of the biohazard and monitoring health status of workers in the area exposed to biohazard. In conclusion, biological hazards are one of the crucial concerns in many industries. Thus, controlling their meal is the key factor for ensuring safety and health.